So it's important to a lot of people to understand the benefits and risks to epidurals and the impact that epidurals can have on labor. And of course, all of your questions about medical things should be referred back to your care provider because they know your medical history and your pregnancy and the medical situation that you find yourself in, and they'll be able to give you the most relevant and specific information to you. But in terms of generalities, we can talk about what some of the benefits and risks are. And a lot of people are aware of the risks in terms of stalling or slowing labor. That's a really common thing that people are concerned about. And it's absolutely true that epidurals can at times slow down labor. Sometimes that depends on when in labor you get your epidural. Generally speaking, if you're further along in labor, if you're closer to transition, if you're further dilated than sort of early labor, then your epidural won't slow labor down. But if you're someone who you've had a lot of prodromal labor, or you just don't want to go through labor without an epidural, and that's fine, then and you elect to have your epidural when you're admitted at the hospital, so closer to 3 to 4 centimeters, it's definitely possible that your labor won't be active enough and in a strong enough pattern to keep going with the epidural. And in that case, the risk factor there is that they're going to need to add synthetic oxytocin to your IV to help your labor get into a really good and established pattern. And the benefit is that you won't feel the increase in the oxytocin because you have your epidural and your epidural is working well. And they'll make sure your epidural is working well before they put the synthetic oxytocin in. One of the other risks, there's always small risks of a headache. That's a very common, by very common we mean 1 in 200, I think is the current number. And there's a slight chance that if your headache persists past labor, that they would need to do something called a blood patch. So if you do have a headache caused by your epidural, it's really good to let your care team know, and they can help you with that. Another more common side effect and risk factor of an epidural is a drop in blood pressure. And that's why they don't want you getting up and walking around, even though technically the epidurals we give in Canada are walking epidurals. You're not completely numb. You are still able to move your body. They don't want you up because it can cause this drop in blood pressure. It's also why, even if you don't have an IV or you haven't had an IV up until that point, if you ask for an epidural, they will start an IV and they will put IV fluids in to help you with that risk factor in terms of your blood pressure dropping. The extra fluids help to prevent your blood pressure from dropping too quickly. Some of the benefits, though, are that you're not going to be in pain. Labor it's called labor for a reason. It's hard work, and for some people, they don't want to feel the contractions, and there's lots of reasons for that, and they're able to get the pain relief from an epidural that they want. And epidurals are not always 100% effective, but usually if they're not working, the anesthesia team is able to help you and to do something about that. One of the other benefits to an epidural is if for some reason you need to go to a cesarean, it can be done a little bit faster. They don't need to wait quite as long. The catheter is already placed, and they're able to keep going, and they move you to surgery a little bit faster. It's one of the reasons that epidurals are recommended here in all twin and triplet births. For multiples, they strongly recommend that you have an epidural placed and working, and that's so that if for some reason something happens between twin A and twin B, that you already have an epidural on board, and they can just up your medication if they need to go to a cesarean. It just means that if an emergency ever did occur, there's a higher chance that you will be able to be awake for the birth of your baby rather than needing to go through general anesthesia.